First question of the day. How much blood does the human body have?
5 liters.
5 liters.
Yeah.
So out of the 5, how much do you take for blood tests?
Depends on what kind of blood test we're running, but if we are talking about hair-related blood tests, about 15 mils.
15 mils would look like what?
15 mils would look something like these 3 vials, and that's like half a shot.
Half a shot? Half a shot?
Half a shot.
Let's
It's quite small.
So maybe we can dive deeper into hair-related blood tests. Why is it important for Terra Medical to order blood tests for the patient?
Okay, so not just for any patient, but patients that we suspect that the blood tests that return results may have a bearing on how we treat the patient. Okay, so it's not like we throw a whole cascade of blood tests at them without any intention to change our management. So blood tests such as, for example, vitamin D, ferritin, zinc are very commonly ordered in Terra Medical because we find deficiencies or relative deficiencies in these micronutrients amongst hair loss patients. And if you want some numbers, ladies who present with female pattern hair loss, about 91% of them have a vitamin D level of less than 30 nanograms per mil. Ladies who present with chronic telogen effluvium have about 83% of them have vitamin D deficiency, and in alopecia areata is about 81%. So we commonly see vitamin D playing an important role in the hair growth process, and that's why we want to know what the vitamin D status is. Given current day where everyone's hiding away from the sun or slapping on too much sunblock, we do encounter quite a lot of deficiencies with vitamin D, as an example.
Okay, so if you are in Singapore and you have a vitamin D deficiency, what would you recommend for people who still don't have any opportunities to go out under the sun?
Okay, so usually we'll recommend some kind of oral formulation vitamin D supplement. An example would be Terra's Golden Ratio Women for the ladies or men for the guys, or it can be direct vitamin D supplementation of an appropriate dose. So it's very commonly misunderstood that you just need your USDA recommended dose, such as 600 to 800 international units per day to keep your vitamin D levels sufficient. Completely misunderstood. We need something like 2,000, 3,000, even 5,000 international units a day just to get the levels to something that can maintain and protect your hair.
Okay. Alright, so we talked about vitamin D, we talked about ferritin, talked about zinc. Apart from these, are there other markers that you look out for that might also affect your hair?
Yeah, certainly. So it depends on the clinical scenario and whether there's anything we're going to do about it. So for example, in a patient who is postmenopausal or has told me that she's no longer planning for any kids, we'll actually test for her male hormone levels. They may not directly be relating to her hair loss condition, but if there is a treatment target there, let's say her male hormone levels will go very high, we would want to dive deeper and establish whether or not she has any kind of other gynecological disorders that are relating to that, and refer her to the appropriate specialist to get that treated. But also at the same time, we can start some hormone adjustment therapy such as spironolactone or finasteride or dutasteride, depending on the clinical context, to help her hair stay in the anagen or growth phase.
So other medical conditions could also include like PCOS and stuff.
PCOS, hypothyroidism, sometimes things like chronic stress, which can be picked up on a 24-hour cortisol kind of management, can also be ordered, but that's a saliva test, not really a blood test.
But from the blood tests alone, are you able to tell if stress is a factor that's affecting your hair?
It's quite hard, so usually that will come from history taking. So I'll ask the patients what kind of stress they're experiencing, which avenues of stress, is it affecting the sleep, and so on, because those all are markers that point to chronic stress, and chronic stress leads to an elevation in cortisol and subsequent elevation in something called DHEAS, which is also a male hormone type functioning molecule that can also cause miniaturization of the hair follicles.
Okay. So would you recommend that if people are seeking treatments for their hair loss, they would request that their doctor do blood tests as well?
I think a lot of doctors would run the basic blood test, thyroid function, as well as FBC, which is the full blood count, check whether they're anemic, and maybe some iron studies. But they're missing out on a big chunk of information if they're just limiting themselves to such. And a lot of places that do not have the facilities required can't actually run things like serum copper or serum zinc. They would have to arrange it with a separate lab. So here we run the full suite of diagnostics for hair loss. Yeah, so if it's primarily a hair concern, here's the place that you want to take a blood test done.
Okay. So let's just say the patients are seeking treatments in other countries, so they're not here in Singapore. What questions would you recommend that they ask their doctors when it comes to blood tests? Or if they are keeping the blood tests for themselves, what are some maybe tips that you can share for people to be able to understand their blood tests better?
So I think that if the patient is 35 and above, okay, and have not done a full general health screen, please start with that and include those markers that we talked about, right? Vitamin D, zinc, and some kind of iron studies, because that's the age that is recommended to start health screening, and this also helps you identify any comorbidities or other medical conditions. And these other medical conditions might actually be contributing to hair loss, or medications used to treat these chronic conditions such as blood pressure pills or cholesterol pills might actually induce hair loss.
So for example, let's say you're treating the hair loss and they are taking these pills. What direction would you go?
Well, we have to weigh the benefits versus the risks of using these medicines, and understanding that there are chronicity. There are going to be long-term medicines unless patients get their cholesterol managed well enough on their own. We do counsel them. We tell them that there's going to be limits to what we do if it's medication induced, especially if the medications are necessary, and this could involve more complex medications such as immunosuppressants like steroids or tacrolimus or methotrexate. Those usually should not be stopped unless there's good reason to, because they serve a function in protecting against certain pathology. Yeah, but we can optimize the hair with various other means depending on the diagnosis. So let's say it's androgenetic alopecia, we want them to be on finasteride or minoxidil or both.
Okay. So we sidetracked a bit there, so we go back to nutritional deficiencies. If, for example, we are treating nutritional deficiencies, how long should a person wait to expect to see results?
Okay, I think that depends on the starting point. So we know that if we dose somebody, let's say with vitamin D deficiency, we dose them with 2,500 units of vitamin D per day, assuming good absorption profiles. That means they take it after a meal. We're expecting the vitamin D level to increase by 5 every month, 5 nanograms per mil every month, and that our target is usually about 50 nanograms per mil in the blood. So if the patient started at 15 and you count backwards, that's a shortfall of 35, so that'll be like 6 months.
Oh, so minimum maybe around there, around 6 months.
Yeah, it depends on where the starting point was and what targets we're aiming for.
Okay. So if the expectation is to wait 6 months, does that mean I would have to do blood tests like every 6 months?
That's not usually what I recommend. Usually in Terra, what we do is we take photos at every encounter. And if the photos are showing a steady state improvement in the hair, you're reporting less hair fall, we use the clinical picture to judge whether or not these nutritional supplements have been working for you, rather than rely on just purely numbers. We don't want to just treat numbers. It's always a good advice, because vitamin D can always drop if you're avoiding supplements or avoiding the sun, to check it every couple of years, and that's what I would recommend my patients to do.
Okay. So I guess for the viewers, if you guys are already doing a general health screening, correct me if I'm wrong, you can already take note of these markers and then see if any of these markers are affecting your hair, if your hair is a problem right now.
Yeah, absolutely right. You can add that, because you're already going for a blood test that will add another 15 mils to your already quite extensive blood work. But if you're unsure about what those numbers mean, because in the context of hair, we're not always looking for in the range, we're sometimes looking for upper end of the range, or sometimes looking for to bring it down from the upper end of the range to the lower end of the range, depending on which blood test we're talking about. Seek advice from a hair restoration professional. With the correct advice, you'll be able to achieve more out of your hair treatments. If you like this content, don't forget to like and subscribe, and we'll see you next time.